If you get COVID-19, do you know what you're going to pay out of pocket? That can be a tough question to find an answer to. Hey Siri, if I get COVID, what am I going to pay out of pocket? Siri? Useless. Well, in this episode, we'll try to explain what you'll have covered and what you're going to have to pay out of pocket. Hi, my name is John. I'm your healthcare hacker and your pandemic financial assistant. Before I go on, please take a moment, like this video, and subscribe to our channel. This video was filmed on February 21st, 2021, so things might have changed depending on when you're watching this. That's the one thing about COVID. It's constantly changing. So let's start with the easy stuff. If you need to get a COVID test to see if you have it, it will be covered. You should not have to pay anything out of pocket. The only exception would be if you got a rapid test where they demand cash up front. If you do that, get a copy of the invoice, submit it to your insurance company, and it'll be 100% covered with nothing out of pocket. Secondly, when it's your time to get the vaccine, that'll also be covered 100%. Now it gets a little bit more complicated. First, with antibody testing. If you're getting a COVID antibody test, you really need to look at what your insurance covers or doesn't cover. It depends a great deal. And it's ever changing. When it comes to treatment of COVID, it gets a little bit more complex and the situation is a little murky. It really depends on the type of insurance you have. Every plan handles it a little bit differently. When COVID first came on the scene and was identified in the US, many health plans decided to cover it at 100%, where we, the consumer, didn't have to pay anything out of pocket. However, that's changed and evolved. Right now, Medicare still covers it 100%, but a lot of commercial insurers, as well as a lot of employer-based insurance, now runs it through deductible, co-insurance, co-pay, just like any other disease or illness. So for example, if you have a plan that follows the ACA, you could be stuck with a bill of as much as $17,100 here in 2021. So you got to pay attention to that and make sure you understand what your plan covers and doesn't cover. It's really important. You don't want to get surprised with a large bill, especially at a time when you might not be able to work or your income might be impacted. So pay attention to those details. And as always, make sure you get the facts by joining us in the next episode of Healthcare Hacks.